You got away with it.
How can you do that?
I can do anything I want. And so can you.
Why do you make me flood the school?
They are in great danger.
Where did you come from?
Do you believe in time travel?
Who are you talking to?
Through movies and videos, we will be experiencing firsthand what it is like to be a patient with schizophrenia. Schizophrenia is a psychological disorder characterized by delusions, hallucinations, disorganized speech, and inappropriate emotional expression. Within the umbrella of schizophrenia, many other individual disorders stem off, including delusional disorders, brief psychotic disorder, schizophrenia form disorder, schizophrenia, substance or medicine-induced psychological disorder, catatonia, and finally schizoaffective disorder. Today, by looking at movie characters like Donnie Darko and John Nash, we will dive deeper into the disorder characterized by symptoms of schizophrenia and other mood disorders such as mania or depression that characterizes schizoaffective disorder. When diagnosing schizoaffective disorder, the DSM-5's characterization includes that patients need to have 2 or more of the following symptoms: delusions, hallucinations, disorganized speech or speech that is easily derailed or incoherent, grossly disorganized or catatonic behavior, and negative symptoms. Additionally, they must include 2 or more of the following symptoms: a major mood episode, either major depression or mania that lasts for an uninterrupted period of time, delusions or hallucinations for 2 or more consecutive weeks without mood symptoms sometime during the life of the illness, mood symptoms that are present for the majority of the illness, and the symptoms are not caused by substance use.
Why are you wearing that stupid man suit?
Take it off. What happened to your eye?
Using John Nash from A Beautiful Mind as an example, we can see that from the first section of the DSM-5's characterizations, he has delusions and hallucinations with also catonic behavior following his work as a mathematician. Additionally, he has had this major mood episode, including his depression, you can see, especially with his fighting with his wife that lasts for an uninterrupted period of time, with also mood symptoms that are present for the majority of the illness. And we can see this through his uninterrupted period of schizoaffective disorder.
See them now?
Yes.
Why did you stop your meds?
Because I couldn't do my work. I couldn't help with the baby. I couldn't respond to my wife. You think that's better than being crazy?
We'll need to start you on a higher run of insulin shocks and a new medication.
No. There has to be another way.
Schizophrenia is degenerative. Some days may be symptom-free, but over time, you're getting worse.
Apart from the hallucinations and voices both of these characters see, schizoaffective disorder looks very similar to bipolar disorder. The intense periods of insanity and body movements mirror that of mania and bipolar. Additionally, the intense depression both these characters undergo looks very much like the lows within bipolar disorder. Those different diagnoses can lead to misdiagnoses and also the mistreatment of patients due to their similarities. Along with the diagnosis of schizoaffective disorder, patients are at increased risk for suicide and other substance abuse-related diagnoses. Schizoaffective disorder has about 200,000 new cases in the U.S. every year. There is about 1 in 200 chance for people to get schizoaffective disorder additionally.
At this time, schizophrenia does not have a cure, but there are constantly more ways to cope with it as we learn more about it. There are different types of therapies that can be used to decrease psychotic episodes and lessen their impact. Individual psychotherapy is one method of treatment, where a therapist or psychiatrist talks one-on-one with a patient about their illness and learns ways to discern what is real and what is not. Cognitive behavior therapy helps to allow insight on possible causes and triggers of delusions or hallucinations, which will help them to be avoided in the future. Cognitive enhancement therapy can aid in improving patients' attention and organization of thoughts. As far as medication, antipsychotics, which affect dopamine levels in the brain, are the drugs most often used. It can take time for results to be seen.
You see, the nightmare of schizophrenia is not knowing what's true. Imagine if you had suddenly learned that the people, the places, the moments most important to you were not gone, not dead, but worse, had never been.
Administering insulin.
8:42 a.m.
And psychiatrists may choose to combine or up the dosages of certain drugs. For patients who are not responding to drug treatment, another option is electroconvulsive therapy, which induces seizures by briefly delivering an electric shock to the brain to provide relief. While there are many unknowns about schizophrenia, it's important to look at the disorder from all sides to take the best course of action in dealing with it. Schizophrenia not only takes a toll on the patient, but also the family and friends that the patient interacts with. Those with schizophrenia often have difficulty in school and social situations because of how clouded and disjointed their thoughts and actions may seem from everyone else's. It's important that anyone involved with someone who has schizophrenia understands the daily challenges that it presents. It may be a good idea for such people to join a support group and talk to others in similar circumstances. It is not certain the cause of this disorder, but some common risk factors include older paternal age, lack of oxygen during birth, low birth weight, and maternal diabetes or influenza at time of birth. Environmental factors can also play a role, such as when the fetal brain is impacted by famine or flu season, and when someone is born in places with crowded populations or born during winter or spring after the flu season. Schizophrenia has also been explored through media and has been portrayed in many movies. This disorder is often seen as infamous because of the dark secret it seems to hold, but the struggle is very real to those who have it. The best thing we can do is to learn all we can and continue to search for a cure.
This is real. Maybe the part that knows the waking from the dream. Maybe it isn't here. Maybe it's here. I need to believe that something extraordinary is possible.